Ginger, benefits, uses, side effects, and evidence-based insights. Ginger, a widely used spice and medicinal herb, boasts over 100 active compounds potentially offering significant health benefits. Research suggests it may reduce inflammation, aid in diabetes management, and even support weight loss. This article provides a comprehensive overview of ginger's uses, backed by scientific evidence, along with dosage recommendations and safety considerations. Why ginger matters? A growing body of evidence for centuries, traditional medicine has relied on ginger for its healing properties. Modern science is now confirming many of these uses. Inflammation is at the root of many chronic diseases, and ginger's anti-inflammatory effects are a key reason for its growing popularity. Combating inflammation and oxidative stress. Ginger contains potent anti-inflammatory compounds like chaga gills, gingerols, and zingerone. These substances block inflammatory pathways, such as nuclear factor kappa B, NF-kappa B, reducing levels of inflammatory proteins like TNF-alpha and IL-6. Studies show ginger supplementation can effectively decrease these markers, potentially easing symptoms of conditions like arthritis. Oxidative stress, caused by an imbalance between free radicals and antioxidants, also contributes to cell damage. Ginger helps neutralize this by reducing reactive oxygen species, ROS. A study on people with type 2 diabetes showed that 2 grams of ginger powder daily for 12 weeks significantly lowered levels of malondialdehyde, a marker of oxidative stress. Protecting against heart disease risk factors, high blood sugar, blood pressure, and unhealthy cholesterol levels increase the risk of heart disease. Ginger may help mitigate these factors. Regular ginger consumption is linked to a lower risk of hypertension and coronary heart disease. Research shows ginger improves lipid profiles and blood sugar control in at-risk individuals, including those with diabetes. One review found that 1-3 grams of daily ginger supplementation for 6-12 weeks improved cholesterol levels. Lower doses, under 2 grams, were more effective for reducing triglycerides and total cholesterol. Managing diabetes, blood sugar, and beyond. Ginger may be a valuable addition to diabetes management. Supplementation can improve blood sugar control and reduce heart disease risk. A study on 103 people with type 2 diabetes showed that 1.2 grams of ginger daily for 3 months lowered total cholesterol and fasting blood sugar compared to a placebo. Ginger also improves long-term blood sugar control, as measured by hemoglobin A1c, HbA1c, and helps lower blood pressure in people with type 2 diabetes. Relieving nausea. A proven remedy. Ginger is a well-established remedy for nausea. Compounds like chaga gill and gingerols stimulate saliva and gastric secretions, accelerate stomach emptying, and block serotonin receptors in the brain. Ginger is effective for treating nausea in pregnant women, chemotherapy patients, and those recovering from surgery. It's even more effective than vitamin B6 for pregnancy-related nausea. Pregnant women should consult their doctor before taking ginger supplements. Supporting weight loss. A potential aid, while diet and exercise are essential for weight management, ginger may offer additional benefits. One review found that ginger supplementation significantly decreased body weight and waist-to-hip ratio in overweight or obese individuals. A lower waist-to-hip ratio indicates less abdominal fat, which is linked to increased disease risk. Ginger may promote weight loss by enhancing fat burning, blocking fat absorption, and suppressing appetite. More research is needed to fully understand these effects. Dosage and how to take ginger. Ginger is available in capsules, tablets, powders, and liquid extracts. For managing blood sugar and cholesterol, 2 capsules daily, 1 before breakfast, 1 before lunch, have shown effectiveness. Many studies use divided doses for optimal results. Fresh or dry ginger can also be incorporated into meals, teas, and smoothies. Typical research doses range from 1-3 grams per day. However, higher doses are not necessarily better. A review found that doses under 2 grams were more effective for lowering triglycerides and cholesterol. Safety and potential side effects. Ginger is generally safe, even at high doses. However, doses exceeding 6 grams per day may cause digestive issues like diarrhea, heartburn, and acid reflux. High doses may also affect blood clotting, increasing bleeding risk. Individuals undergoing surgery, with bleeding disorders, or taking blood thinners should avoid large doses. People with gallstones should avoid ginger supplements as they stimulate bile acid secretion, potentially worsening the condition. Pregnant women should consult their doctor before use. Drug interactions to consider: ginger may interact with certain medications. Antiplatelet and anticoagulant drugs may increase bleeding risk. Diabetes medications may lower blood sugar levels. Immunosuppressants may alter blood levels. Always consult a doctor before adding ginger supplements to your routine if you're taking medication. Conclusion: a promising natural remedy, ginger offers a range of potential health benefits, from reducing inflammation and heart disease risk to managing diabetes and relieving nausea. While more research is ongoing, the existing evidence supports its use as a safe and effective natural remedy when used responsibly. Always consult with a healthcare professional before making significant dietary changes or starting new supplements.